The National Emergency Management Organization (NEMO) is responsible for reviewing the disaster plans of all institutions on the island. The evacuation component of the disaster plan falls under the purview of a specialized unit in the fire department.
Any developer or any contractor coming in to build any new premises, they are required to send the copies of their plan to the fire department, so our personnel can review the plans to ascertain whether it meets the required standards as far as fire safety is concerned.
Once the fire chief and his team are happy with the evacuation component of the document, and we in turn review the others, like backing up your files, make sure you have the emergency numbers in place, what to do if there's a bomb threat, the telephone numbers, etc. We then recommend to the permanent secretary that that plan can receive their signature of approval. Once the plan is approved, then we move in with Red Cross or fire or police to do a drill.
NEMO Director Don French says discussions must be held with staff to inform them of their roles in a drill or simulation exercise. Medical facilities like the St. Jude Hospital, damaged by fire in early September, went through this process. But the current disaster plan would have to be revised should the government decide to proceed with the renovation or reconstruction of the hospital.
We've gone into institutions where internally they have reconfigured the walls. They have, condemned doors, opened up new doors, put archways. You need to review your plan in terms of that, because the plan is saying if something happens, you need to go through door A, and door A no longer exists. It's door B that's been in place now. So once you have done those kinds of configurations and made changes, you need to go back and review the plan.
Saint Jude Hospital was constructed in 1942. Fire Chief Leslie Fontenelle concedes the building's age made it difficult to enforce modern safety procedures. He says a new structure would be subjected to stricter guidelines.
If that building were done today, it would have to conform to certain safety requirements. The agencies involved, the Ministry of Planning, the town planners, the Development Control Authority, the Fire Department, Ministry of Health, all these agencies now bear in on any construction of any kind of public facility, and any commercial facility for that matter. And so they would, of necessity, have to conform to those standards.
A forensic investigation to determine the exact cause of the fire is currently underway. The fire chief says authorities do not yet know if there is a link between the safety conditions at the complex and the fire. He warns against speculation until the findings of a thorough, in-depth investigation are revealed.